Terrific. It shows we are live on both of our platforms. I just want to check, especially since my internet's acting funky today, that we can see both of us, which we can. Let me share this. Story. And share. Okay, for those of you that are hopping on, give us that thumbs up and a comment. Let us know you can see us and hear us fine. I'm almost done spreading the word, and then we can get started. Excellent. I see Parker Brown with us. Good morning to you, Parker, Nick Clevenson, and Tina Francone. So good morning to everybody that's already hopped on with us. Hello to you, Wayne, as well. Thank you for the morning note to both myself and the mayor this morning. So I'm excited. We have a bunch of people that are popping on, Mayor Atchison, and now I'm definitely going to try and add some positivity here in a little bit. Councilor Scully, good morning. Elizabeth or Liz Price, hello to you as well. We are going to go ahead and get started. I know the mayor has some content that he wants to share with us. Be sure that you type in any comments or questions that you might have so that we can address them at the end of our broadcast. As you can see, we pull up that comment. It does show your name and your profile and the specific wordage or verbiage that you've shared with us. And we try and recognize you for hopping on with us. So thank you for taking the morning, about 30 minutes out of your morning to spend it with us. I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce. If it's your first time landing on our page, don't let it be the last. Make sure that you like this page. Make sure that you're also following us so you can get those timely alerts and updates. And then share the information, especially things like our mayoral updates, like our Friday recaps, county and state level. All of those generally apply not just to our immediate community and surrounding neighbors, but to community-wide folks. So we want to get the word out as much as possible. As you all are aware, we've been hosting these broadcasts for some time. They're all available to you at your disposal on the videos section of this Facebook page. They're also available on our COVID Resource Hub on the Chamber, westminsterchamber.biz website as well. Find us on all social media platforms, Twitter and Instagram at WestD Chamber, and of course on YouTube, Westminster Chamber of Commerce. So today, as you all are tuned in and are aware, we have our mayor with us, their Mayoral Monday updates, where we have Mayor Atchison share information from CityLens. Some of it can be social issues, others can be county and state, and even federal updates that he has seen and been made aware of and thinks that is relevant and timely for you to know. So I will turn this over to our mayor to share those updates. I'll try and give kudos as I see you all, like Jason Gank. Good morning to you, and Councilor Seymour. Thank you all for hopping on with us. Mayor, you can take it away.
Well, I intentionally left this first part thinking, how was I going to break the news to Juliette about this first item? Because I know that she's going to be heartbroken. But Juliette, the Bahamas has closed this door to all U.S. citizens. So you
Has it really?
Yeah, you can't go visit. But there's a number of things that occurred over the weekend, and unfortunately, we're at that stage. I would love to come on one of these Monday meetings and not talk about COVID-19. But unfortunately, that's what's in the news, mostly around those areas last week, this week, and over the weekend, we had a number of issues. Now, if you recall, if you've been hiding from the public news, I'm afraid to bring you more bad news, but remember the statewide mask order is now in place from the governor. But that does not relieve you of the Jeffco Health and Tri-County orders, as those are more extensive than what the governor put out. The governor's order only deals with indoors. So anything to do with groups, variances and stuff like that from either Tri-County or Jeffco Health, those are still in place. Now, we also got an announcement over the weekend that the Colorado public health officials are requiring many counties that received variances but are now seeing higher case counts to submit mitigation plans by the end of the day today, or risk having the variances rescinded. The plans must demonstrate how to stabilize and reduce cases. As an example, CDPHE sent a notice to Jefferson and Guilford counties, and I'm going to read right from the web hosting we got last night. With the increasing number of cases we're seeing both in Jefferson and Gilpin counties, we have been warned by CDPHE that both counties are getting close to falling out of the low-risk category, which may jeopardize our variances. This would be catastrophic to many of our businesses, and we are currently working on the mitigation plans in an effort to prevent such actions. With all of these, keep in mind that anything that does with occupancy, business openings, outdoor activities, all of those in Adams and Jefferson are now in jeopardy because of the fact that we have such rapid rising numbers. Now, here within the city, a number of our departments had started to looking at slowly bringing people back into some of our public facilities. But due to these rising numbers, not only in Jefferson County, but Adams County as well, those returns to business are going to remain stopped for the time being. We're going to continue virtual meetings. We're going to continue people working from home or wherever they're at virtually due to these numbers and the potential of infecting others. Masks will help, but people really need to stay away from each other according to new Colorado State modeling, which was released over the weekend. Now, this one is testing delays are hindering Americans' ability to control the virus, experts said on the morning news shows yesterday, and the results showed that they are not readily available within 48 hours, but in many states, that backlog is taking more than a week. I know that Governor Polis called the national testing situation a complete disgrace on the Meet the Press program yesterday morning. Jefferson County schools are discussing hybrid style of return to school. Our Westie Public Schools previously announced the full return to in-person learning, and I have not seen a final plan for Adams 12. Denver Public Schools will start the school year August 24th virtually, possibly returning to in-classroom learning on September 8th. But they're not going to be doing that on a 2-week basis. Every 2 weeks, they'll make a decision for the next 2 weeks. Over the weekend, the town of Lyons had to shut down its parks until further notice, citing crowds and COVID risk. So even in the parks and some of our mountain communities, we're seeing reaction. And some of the things that a little bit different from COVID was the Senate Bill 217 that's had a lot of activity last week. We may have discussed this last week, I don't recall, that we had one city that took a formal stance in opposition to the 217 bill, and that was Greenwood Village. Well, Greenwood Village is seeing public reaction to that measure adopted by City Council in regards to the Senate 217. And a lot of the activities that were scheduled at Fiddler's Green, those groups are now refusing to come into Greenwood Village in protest of the position that the city took. We've also got a big issue facing us this week. Many of us, for our businesses and employees, this is the final week of the $600 unemployment stimulus. Even though we've had some reports that the federal government's going to take this back up this week, we've had no immediate indication that Congress will extend this because of the differences where the Senate and the House are between the two of them. Now, one of the things I wanted to go back to, currently, according to the report from the 14th, Colorado is in the yellow zone for cases, indicating between 10 to 100 new cases per 100,000. Now, this is several days old, so I don't know how we are currently because they haven't issued anything. But cases have been rising steadily over the past several weeks. Cases are concentrated near the urban centers of Denver and Colorado Springs, and test positivity also increased last week. The following 3 counties have the highest number of new cases over the past 3 weeks. First was Denver County, second was El Paso, and third was Adams. In these areas, there's still a huge demand for people to try to comply with social distancing, wearing of face coverings of whatever kind you have. It doesn't matter as long as you got something to help do this. But we're not seeing the kind of downturn in positive cases. I talked to 2 hospitals last week. Both of those are at over 90% of capacity. And it's not heavily on the COVID side, but it's on other health issues that people have been avoiding taking care of their health because of COVID, fear of going to the hospital. So diabetes, heart issues, stroke issues, other medical issues that people have not been seeing their doctors regularly on are seeing a major uptick on the hospitalization Both hospitals indicated they still had COVID patients in. I do not believe either one of them had anyone on the respirator at the time that we talked on Thursday, but that doesn't mean they aren't today. But with the big part, which affects us mostly, those of us in Adams and Jefferson County, if you own a business and you want to stay open, you've got to help us work with everybody concerned to get our numbers down. My fear is that we could be going backwards really quickly if we're not careful. Going back to stay at home is likely to mean that your businesses are going to close. Our outdoor activities are going to get constrained to the point that there will be nothing going on outside. And all we can do is ask everybody to do everything they can personally to help us drive these numbers back down. I don't want to see one business in any part of the metro area to have to go backwards and shut their doors. That impact alone could be a major catastrophe to our economy, just as we're starting to see some daylight of people being able to reduce the amount of people who are laid off. We start to see a few jobs coming back, more occupancy opportunities in our businesses. We have got to work on this together, folks. It's not one person, it's not one group, it's everybody pulling together to try to get these numbers to reverse what they're headed to today. As soon as we know anything about the mitigation plans from either Adams or Jefferson County, we will work with Juliet to try to get that to you as soon as we can. But since they only got this over the weekend, the notice to me is less than 12 hours old. So I know they haven't gotten anything, but we're hoping to hear something from both health departments within the next 24 to 48 hours as to what their plans are for mitigation. We still have issues with people gathering in large groups, not wearing facial coverings, not doing social distancing. So those kind of issues are still a big problem for us. Juliet, I wish I had something to smile about. Unfortunately, with what's going on over the weekend and what we're seeing this morning, we're still headed in the wrong direction. But if someone has specific questions that I can answer, I'll try to do that. But ladies and gentlemen, we have got to work together to get this problem behind us.
Well, thank you, Mayor. We have had a number of folks that have hopped on with us. German, hello to you. Danielle Hicks, Emilio, Dave Carpenter. I see Jocelyn and Joshua. Good morning, everybody. We have our mayor with us, Mayor Atchison, who's shared on a number of items related to COVID specifically. The one outlier was the Senate Bill 217 in regard to law enforcement, which we touched on in a few different broadcasts and more specifically last week with some of that had gone through the rumor mill, et cetera. For more of the specific data and metrics that the mayor has shared, I've tried to capture a lot of those in the comment section of this broadcast. But please feel free to type any questions or comments, even if you just hopped on, so that we can loop those in. So as I start formulating my own questions, because I'll always throw questions your way, Mayor, we do have one that's come to us from Dave Carpenter. Now, this is in regard to data as it relates to outdoor transmission. His question is asking specifically, do we have any data showing COVID cases coming from outdoor transmission or any indication of what the activities are that are causing this increase in cases?
Dave, to the best of my knowledge, if there's something that has data that's showing where the cases are coming from as far as any potential, whether it's indoor or outdoor, you'd have to go directly to the health department website, because it could be different depending upon the health department and what county you're in as far as what we're in. As what activities, it's anything where we're seeing large gatherings, and this is typically all age group, are out having less than required social distancing, not wearing facial coverings, being in groups where people are not taking care of each other. That's where the indication is that most of this is occurring from. Now, that doesn't mean that people indoors aren't doing the same thing. We are aware through the health department there have been a number of large private parties going on in homes and other places where people are gathering and they're not doing anything to protect themselves. Cases like that are examples of what are some of the things that they're seeing, where these cases are getting infected and then they're transmitting to other people.
Thank you. And I think that's something that's important to note. Our mayor touched a lot on the masks, but one of the things that you really did emphasize at the start, and I think that's the more crucial element, is the social distance piece. So even if you do have something on, being right up next to somebody else does not help you in the long run. It looks like we have a comment/question. This comes just from Parker, and Parker's question relates to the orders that deal with mask mandates. So as many are aware that are tuned in, we had our state order that came out by the governor as it relates to public spaces having the masks on, especially indoors. And then we had discussed prior to that both Tri-County had one that would have gone into effect on the 24th, and that Jeffco was likely releasing one as well. So Parker's asking, and he's sharing that he was told, I'm not sure who he visited with or who told him this, that Jeffco Health rescinded the mandatory mask issuance. That way we can follow the state order only. Is that a valid statement or no?
No, it's not. Remember, there's two different pieces of this. Both health departments, Tri-County and Jeffco, have new health orders in place. They did not rescind either one of those. The state's order overtakes the county as far indoor. Then it mandates it. But we were already with mandate with both counties, Tri-County and Jefferson County already. The only difference between the two is that the state's order only dealt with indoors. It did not deal with outdoor. So those portions of the county orders that were already in place have not been rescinded. I'm not aware that there's any indication that they will, because they complement each other. In the case of the facial covering, that has the higher authority being the state, but the rest of it that's tied to those as far as social distancing, outdoor activities and anything, that really didn't change. But the difference is, keep in mind, under the county orders, businesses that don't enforce this, those are the ones who are at risk of having something happen to their license or a fine through the health departments. So keep in mind, the best thing you can do is follow the both. They're complementary to each other. One doesn't overrule the other one, because they deal with two different pieces of it. So the state's order prevails on indoor. Everything else, you follow your county health order.
Excellent. Thank you, Mayor, and thank you for clarifying, because it does get confusing sometimes when you're looking at those layers of government and some direction that they're providing. Hello, Councilor DeMont and Tina Francone. It looks like we also have Patricia that's hopped on here with us. Thank you guys for tuning in. We've got in the comment section of this broadcast a lot of what the Mayor has referenced. If you have any questions or comments, let us know. We'll take them up as we see them as well. Mayor, there were a few different things that you shared that I just wanted to pick your brain on, really. One was as it relates to hospitals. And this was, I think it was a couple of weeks ago that you and I were discussing that, if you're not feeling well, do not stay at home. Like, a lot of people are really dealing with some life-threatening circumstances, whether it's a stroke or high diabetes, high blood pressure, and they can't control it, but they were avoiding hospitals. But it seems like there's now an uptick that they have taken that message, thankfully, and gone whenever they needed that. But it also shows that larger increase in the hospitalization of them, of 90% capacity. Do you know if is the traffic going and coming, has that consistently stayed at 90% for them, or is that just kind of daytime check-ins?
That was good for the minute that she told me the numbers, because those numbers change depending on what it is. But I think one of the things is to take a lesson out of this. Don't defer your health care just because of COVID. There's a number of ways to get in to see your doctor, either virtually, by phone, through the internet, and in many cases you still need to go in to get lab work done. Don't put off your health care just because of COVID, because that could make your situation much worse, up to and including it could cost you your life, especially if you're in a critical care situation where you really have to have constant update with your doctors. Mm-hmm. Don't jeopardize your life over worried about COVID. Your other health issues could become more deadly than COVID could. So make sure you stay in touch with your doctors, get the health screens you're talking about. And I think one of the things that we saw some of the national news on over the weekend is children not getting inoculations for childhood diseases and stuff. And again, because of COVID. But we are starting to see some movement around the country that different areas have started to make some of these labs mobile and taking them to the children to make sure that they get their inoculation. So I don't know of any of that going on in Colorado at the present time, but it's something that we will have to continue to watch through our health departments, because with school getting ready to start again, the worst thing we need to do is add another big outbreak of something in the schools that we can't control, along with COVID and other issues.
Yeah, and absolutely. And I think that, that was one of the things earlier on, we were encouraging the stay at home and wear the masks, was to try and stagger that significant pressure on the hospital systems. And so addressing your immediate needs as opposed to waiting and then all going as a vacuum at once definitely would help our healthcare workers. Jason Manzak and Kyle Tiffey, thank you both for hopping on here with us as well. Mayor, there was one comment you made earlier, and this related to the testing delays, how some places should have those available within 48 hours, while other states are taking longer than a week for the results to actually come back to them. How does Colorado fare in this? Are we closer to the 48 hours and we receive those results, or are we one of those states that has been delayed in receiving some of the test results that we were needing?
I think it's some of both, depending upon which labs you're going to. Remember, we talked about last week, on Thursday night, we talked about the fact that a test facility was going to be opening up down at the MAC. That starts this week. If you think about the major test center is down at the Pepsi Center, but they're limiting those tests to 2,000 a day because they are having such a rush on people and trying to get those lab tests done and returned. Now, there's still lab testing being done in other locations throughout the metro area, but the big one is primarily there at the Pepsi Center. As great as that is, there is still the issue of people being able to get there. If you don't have a car, how do you get to the Pepsi Center? Because everything you see on the news broadcast about it is lines and lines of cars with up to 2,000 a day, but you don't have a way for people to walk up or to come through another mode of transportation as it's looking right now. So how is our vulnerable communities getting tested? Now, having one at the MAC, that's in a central location where we hope people have the ability to get there either through public transit or walking if you have to. If there was a real need that somebody had to have this test, they can't get there, call the city and we'll do what we can to help.
Thank you, and thank you for clarifying that for us, because I know that's definitely one of the questions that folks are wondering is, where does Colorado fall in line of nationally, and how do we fare with everybody? As it relates to variances, and this was something that we touched on a while back, how some counties were able to, well, most counties really were able to do this, but some chose to submit variance requests for select industries to open back up under specific criteria requirements that they had drafted for them. So this allowed, for example, we talked about Valdemar Park that's out there in Lakewood, and we talked about a lot of different ones that were approved for various casinos and even table card games and things like that. We touched on them in this broadcast, as you saying that some of them have not turned around to say, here's what we're doing to mitigate the rising numbers that we might have, or to make sure that that does not affect their count within their jurisdiction or their county. Now, to complement that, we also had the announcement from the governor that said about to protect our neighbors, which would have been the next state that some counties can submit to qualify for. Do you know if any counties actually submitted with this? I mean, when we're seeing that the basic variance requirements are going a little bit unmet, have there actually been counties that have moved to that next level, or is there no one that's really utilized that option yet?
If there's anyone who has submitted, I'm not aware. The last part I know of, I'm going to say it was Thursday or Friday, no one has been approved for it. But in the conference calls that we had late last week, any new variances coming into the state have been put on temporary hold because these numbers are going back up again. So I don't know that anybody has actually completed the exception requirement nor completed an approved mitigation plan. So for right now, to the best of my knowledge, as of the end of last week, any new variances being approved by CDPHE are temporarily on hold. I am not aware of any county or health department that represents one or more counties that has submitted the exception request. And I certainly am not aware of anybody who has been granted one.
Excellent. Thank you so much. We have a comment that comes to us from Danielle Hicks. It also looks like Tina has some information related to Jeffco. She's included that link for us into the comment section of this broadcast that we'll all kind of take a look at here in a little bit. But Danielle is sharing, thank you for these updates. They've given me this information, and as a mom of an at-risk child or kid, these updates have been very helpful. So thank you, Danielle, for tuning in and for expressing that to the mayor. Of course, I always want to tell him how valuable it is to have him on here for this block of time. So you did mention kids, which kind of sparked my memory on one of the other comments I wanted to ask the mayor. It was, I appreciated you touching on all 3 school districts, and in fact, even touched on a district that does not service Denver public schools. A lot of people are generally interested in them, since they are our largest school district. With that being said, you did mention WPS going back to a normal mode of operation, JPS going to a hybrid structure. Adams 12 is a little in the unknown arena, and then we've got DPS that's still virtual, with the possibility of moving that into something else by September, of course, with updates. So I've read, obviously everybody has been reading articles, one of which in the last couple of days was, this idea that we are the only country in the West that's not allowing for that normalcy back into our school system. Why we have some districts that are allowing for a greater opening back up as opposed to others? Is it more based on what they have in place to prepare students, or are they going based off of different data points that they're interpreting?
Well, I think it's going to be a little bit of a lot of things. And by that, I mean, what's the information they have? What is their ability to get kids into the classroom and make it safe for them? There are some people who are going to go to classrooms who cannot wear facial coverings. We've talked about that a lot. There are some people for a health reason just can't do that. But then how do you handle all the cleaning? If you allow students to move from one classroom to another, you got to clean that entire classroom. How do you protect the teachers and the other paraprofessionals who are down at the schools? Some of these options that if one thing happens, this is what you do. I think in DPS alone, Denver Public Schools, they had 50 different scenarios that they were trying to deal with. How do you get the kids back to school? Do you do it virtual one day, in school the next day? How do you deal with the child care? How do you deal with the parents who've got to stay home one day, but then they can go to work the next day? There are so many variables that every school district has to look at. It's what's best for them. But keep in mind, the adults who are there are still teachers. And they still have some of the highest levels of concern about, is it safe for me to go back to be in front of the classroom? The kids may not be as much prone to having the disease as they are into spreading the disease. I would not want to be in that situation, that I had to make a choice of going back to teaching in front of a classroom where I have a higher probability of getting something. So even though we've had some clarifications on some of the things that Jeffco is doing, we haven't had any updates recently from Adams 12. That's why I don't know what their plan is. I've got some calls in to Chris to see if we can make touch base to see what they've got thought. These are still proactive decisions are being looked at on a daily basis as to what changes. Because no matter what I plan today, if I can't control the outbreak, my plan for the day is no better than it will be tomorrow if the numbers keep going up. Virtual learning is probably here. There are going to be students or parents who are just not comfortable sending their kids back to school. How do you get a teacher who's in a classroom to do virtual learning at the same time? Or if you're going to send a kid to a virtual classroom teacher, are they teaching the same subject the same way they were teaching when they were in a classroom with their normal teachers? These kind of things I know in the education side are very complex. They're very trying, and nobody has a magic answer for any of this. So just be patient. I hope that the schools can work out most of this, because I'd like to see the schools open as much as I'd like to see our businesses open, but not at the basis of just opening for the sake of opening. We have to do this safely. We have got to do everything we can together as everybody working to pull together to help defeat this issue so that we can return to some level of normalcy sooner than later.
Absolutely. And I know we're coming close to time. This was a comment made by Councillor Demott, and we did have a business owner did reply on it, but I just thought it might be nice for us to throw it out there if you are a business and would like to answer his question in the comment section. This relates to mask mandates, if that affects people's confidence in getting out, doing commerce. Does that affect their consumer confidence? It is something that the mayor and I have visited on before about being open for business and what businesses are doing, precautions that they're taking to put some of our consumers at ease. I will say from my lens, and Mayor, I'll have you also touch on this as well if you'd like. There are select industry that, they have shared as soon as whether it's the governor or someone goes up and says something, providing numbers or data points or things like that, it immediately reflects in the revenue, cancellations or delays on things that would have otherwise been booked or had already been booked with them. And then, as Parker had also commented as well, there were some immediate changes in revenue in some of our smaller businesses is seen. So, Mayor, did you have anything you wanted to add to that, or?
What I'm trying to answer Mr. DeMott's question is, look, I don't think wearing a mask or not wearing a mask is going to affect people's decision to buy stuff. Now, they may not go to brick and mortar, but they will get it. If you need groceries, you're going to get groceries. But the mask is not only there to help protect you, but to help protect others you come in contact with. I have seen no indication that mask orders are stopping people from buying things they need, or in some cases doing social distancing and shopping just to be able to get out of the house. So I don't support that there's a correlation necessarily between the mask order and people not buying things.
Terrific. So before we wrap up, for those of you that hopped on with us late, please make sure that you rewind this broadcast so you can get as much information and details as possible. The mayor did spend a great portion of the start of this video to provide us with data and significant updates from over the weekend and just last week that all of us should be aware of. So please make sure that you capture those. If you watch this video on replay, give us that hashtag replay. Let us know that you have tuned in and have enjoyed this broadcast as well. We will be back here tomorrow at 11 a.m. We'll actually be featuring one of our hotel partners, and that's the DoubleTree here in Westminster, to share how they've been impacted through COVID, what they've done to kind of adapt, and how they're open for business now in some capacity, shape, or form. So please be sure to tune in with us tomorrow at 11 a.m. For those of you that are shopping and doing business locally, be sure that you submit to us your receipts. You can DM it to us here on Facebook or email it to info@westminsterchamber.biz. Our Westy Rise Shop Local program is still going on until the 31st of July. For those of you that did win last week, you will be emailed so that we can connect with you, get you your prizes, and take your lovely photos of you smiling, because we need some smiles, especially after today's broadcast. So thank you to the mayor, of course, for spending every week with me. This is the highlight. It kicks us off and sets the tone for kind of what's ahead, and to each of you for spending the morning with us as well. Have a wonderful day.